Welcome to the Continuing Education module entitled Starting Wellness from Scratch, an Approach for Beginners. Our agenda for this module includes the following. First of all, we're going to look at the purpose for this module. Secondly, we want to welcome you to wellness. Third, we're going to share 10 planning tips for getting started and a summary of key points on this particular module, which is really designed for a quick start. The purpose of this module is really to help provide some practical help for the novice to wellness. So if you've not had much experience with wellness, this is intended to give you a very quick start kind of perspective. We are cutting to the chase, so we're not going to give you a lot of the background or a lot of the detail or how these things all fit together, or to look at the complexity of what a program that needs to be successful long-term has to look like. We're going to take a minimalist perspective here and a minimalist approach. We're going to simplify the startup process, and we want you to be able to quick start your program. And you want to get started in as good a way as you can, given the limitations of what you know about this field and know about this particular activity. First of all, we want to welcome you to wellness, and there is no standard definition of wellness. So we actually have a good opportunity ahead of us to be able to define wellness so that it makes sense for the organization and the population that you're working with. We want you to start very simply, and we call that starting with the MESS. And MESS means we focus only on 4 different areas: helping people move more, helping them eat more healthy, and helping them handle their stress and their sleep. So those are the areas that we think of when we think about the context of MESS as being the starting point for what targeting we do in our wellness program. The purpose of your program is to really improve the wellness and well-being of your employees. So that's what we're attempting to do with this quick start approach. We also want to ask some of your coworkers what they might like to see from the MESS. So start with those 4 areas: move, eat, stress, and sleep, and then work on those over time to be able to expand and build your program base. Let's look at 10 planning tips for getting started in this minimalist approach. First of all, we're going to focus on clarifying your mandate. We're going to look at a slide for each one of these. Secondly, we're going to suggest that you put a 1-page summary outline of your program together. Third is to choose your wellness strategy. We'll talk about that. Fourth is to plan your administrative structure. Fifth is to identify the first-year program activities. Sixth is to lay out your marketing approach for the program. Seventh is to determine what policies need to be changed or modified to make wellness easier for people to do. Eighth is to craft the physical environment changes that need to be made to make the workplace itself more adaptive and more complementary to wellness activities. The 9th planning tip is to check out key stakeholder needs, and we're going to identify those as a very small group of key stakeholders. And then 10th, plan out a simple evaluation for your program to be conducted at the end of this first year. So these are a summary of the 10 planning tips we'll now be looking at more in depth to help you get started on this quick start kind of approach. Step number 1 in the planning process is clarify your mandate. And a mandate essentially is, whose idea is this? Is wellness? Who are we looking at and who are we asking about in terms of the wellness activities? Is this an idea only, or is there a commitment to go further than just looking at the possibility of a wellness program? Is there an exploratory process that is being conducted? Is there some ways that people are looking at how this particular kind of program activity might evolve at your work site? Is this a feasibility study? Is there a concern from management to ask the question, is it feasible for us to even do a wellness program? And do we expect, and is it expected of you to come up with a brief proposal for the wellness program? Is it expected to be more major in terms of a proposal? So not necessarily a brief proposal, but does your mandate include the production of a more detailed proposal for the program? And when is it expected? What kind of programming is expected? How extensive? How many targets? How much in the way of intervention is expected? Planning step number 2 is to put together a one-page summary outline of what the program is going to look like. And that usually involves some short executive summary. So we basically want to look at what are we trying to accomplish, what's proposed, rough idea of budget. So we oftentimes put that into an executive summary. There's an overview of why we're doing it. There's a definition that these are the needs we're going to address. We're going to have a mission for the program and a vision for what we want to accomplish. We want a listing of proposed activities. We have a budget that we're requesting. We're requesting a certain amount of budget resources. We have an evaluation plan. So here's how we're going to evaluate it. That can be summarized in a few bullet points. And our next steps, what we plan to do after this particular proposal or summary outline is in fact approved. And having some exhibits in the back of the document, so that's a possibility. If we have a one-page summary overview, we might have 1 or 2 exhibits attached to the back of that to help management get a better sense of what we mean by what's proposed in terms of the outline. And then once we have put that one-page summary together, the way that we get the detail in that is to essentially follow through on the rest of the 10 planning tips and steps that you will encounter below. The third step after that preparation of the one-page activity, part of that process involves you choosing your wellness strategy. So step number 3 is looking at these 3 models. The feel-good model, which does not produce a lot of change, but it basically has the characteristics and features that you see in that central box. It is more of a morale approach to wellness. So we're building morale and helping people feel better about their employer and about the work site and work activity. The second kind of strategy you might choose is a traditional wellness program. And it again has the main features you see in the middle of that particular column. And it tends to be more of an activity-oriented approach to wellness. It's basically saying, let's just get people doing a lot of healthy things for themselves. And we're going to essentially set a table like a smorgasbord or a buffet. And then people are going to come up and take certain things off of the buffet according to their needs and their perspectives and their preferences and their readiness to change. And this particular kind of model for wellness is what we call an activity-oriented approach. We really are doing a bunch of activities and we report back on the activities that have been conducted. We can't really say much about other results, whether it's improving their health, whether it's had an impact on your health plan costs, whether sick leave is down because of it, whether there's higher productivity because people don't have as many symptoms that are delaying or detracting from their productivity. That then leads to this third model, which is what we call the results-driven wellness model. And it has, again, the main features that you see listed in the box in the middle. And it tends to be more of a results-oriented approach to wellness. So in this particular model of wellness, we're actually organizing in a more serious way. We're broadening the range of prevention targets that we're trying to change and affect. We're getting more sophisticated about our incentives and about how we set and change policies, what kinds of changes we make in the physical environment, how we build for various kinds of team orientation and reporting, a whole variety of activities. So that results-driven wellness tends to be a more serious wellness approach. It costs more money, it produces more results. So this step number 3 is choosing your wellness strategy. So you can again choose the feel-good model, the traditional wellness approach, or the results-driven model. The fourth planning step is to plan out your administrative structure. And that means what are we going to, in a sense, use to leverage the program or to help the program be sustainable. We might want to talk about, for instance, the brand, which includes an art style. It includes maybe an icon or a logo. It may include a tagline with a few, key words and key meanings attached to it. So that's where we think about, let's brand our wellness program. We also need a coordinator. And you might be the person that's looking at this because you are going to be the wellness program coordinator. So the issue there is that person is responsible for really being the catalyst to bring about this wellness program activity. The third issue is we're going to need a budget. So what are we budgeting for? What's an adequate budget for wellness? We don't need a lot of money to do wellness, but we need to spend some money and we need to spend it well. So the idea is, what are those resources we're going to use to purchase wellness-related services and or products? We also then usually have to have a vendor. If we want somebody to come in and do preventive screening and help people understand their health, then we need to have someone who has that capability. So that becomes our vendor. Or if we have a well-being assessment we want to give to people, then that vendor has that well-being assessment. And then people are providing information about their own personal wellness, but it gets provided to vendors. So that's a part of that administrative structure. We might also want to put an advisory committee together. So that advisory committee can be both helpers that will help implement the program, but there also will be people that can bring us information back about how people are thinking about it, what they like about it, what they don't like about it. It can also be a group that we want to try out our programs on first as the guinea pigs to see how the program works with the people that are part of that advisory group. We also may want to have a network of champions or wellness ambassadors. And these are people who want to see and help the wellness program actually bring some better health to their coworkers. And they then take on the responsibility of being the advocates for it, understanding what things are coming, explaining it to people, recruiting people, talking about it in staff meetings, but doing the kind of advocacy work that the individuals could do to help people actually utilize the program. We also want to have a work program that kind of lays out, here are the various wellness program activities we're going to be doing, and here's when they occur during the year, and that means I have to start working on them back 2, 3, 4 months earlier to line up instructors for lunch and learn, or get a flu shot vendor in, or being able to bring in a preventive screening vendor. So there's the work plan to help the individual who's really catalyzing the program, coordinating the program, actually put the activities together. In addition, I may want to put together that calendar. So I may have a monthly calendar or quarterly calendar, either online or in paper copy, that I give to people to help them remember what it is that is going to be taking place as part of the wellness program. The fifth planning step is to identify the first year program activities. And this is where I get a little deeper into the issues of what exactly are we going to offer people. And each of these is a possible set of activities that we could craft into a wellness program. The last one down there you see is learning management system, and that's if we have a way of capturing information online and allowing people to view it in a video kind of arrangement usually, and then to take a quiz on the content of that. So that's a great place for us to put a lot of content around wellness. But each of these is fairly self-explanatory, and it just means that these are some of the activities that I may bring together and lay out in the 12-month period I'm planning for. And that 12 months may start on January 1st, it may start on September 1st, it may start on July 1st, but the idea is that I've got a series of activities and offerings that are designed to help people be as well and healthy as I possibly can. The sixth planning step is to lay out your marketing approach. And in general, we oftentimes want to have some sort of rollout activity where we explain the wellness program and why we're doing it to people. In addition, we may have a launch letter or an email. So that becomes an activity that we might do to notify employees about what we're offering in terms of the wellness program. We may have a descriptive brochure about the program that basically lays it out. We may give that to employees, or we may send that to spouses, or we may have employees have it at an orientation session or new employee session. So it's a descriptive amount of information about the program. We may have a way of delivering regular emails. Those emails may go direct to the employees, or they may in fact be cascaded through the supervisors of employees. So we have basically an email connection to people to let them know about their various activities. We may have wellness incentives that we want to have. And most programs, if they want to reach into their population in any depth, have to have some pretty powerful incentives, because about 20% of employees are intrinsically motivated for wellness. 80% are not. So our challenge is, how do we reach those 80% that really aren't very intrinsically motivated for wellness? We also may have email and text messaging with offers. So that's a device we might use to bring the program down to the individual and help it be more individually personalized or tailored. In addition, we may be wanting to think about what kind of approach should we use to the use of teams. Do we want to use teams? And are there group incentives that will also act on the individuals in our workforce to help them be involved in wellness activities and the wellness program itself? And we also want to have periodic management pronouncements where management says to employees, we care about your health and well-being. We'd like you to participate in the wellness program. We're putting resources into that program, and we would appreciate it if you would use it. So these are some of the issues that have to do with the marketing approach. We also may be using wellness ambassadors. So you saw that in a previous slide. So we can use those marketing ambassadors to actually bring more marketing impact to the local groups and the smaller groups within our workforce. So if we have wellness ambassadors, one for each individual work unit, with a supervisor that is over that work unit, that wellness ambassador can really be a major marketing force within that work group. So these are some of the major types of marketing activities that are designed to help people know about the program and also participate in it. The seventh planning step is to determine what policies need to change. And you can have a wellness policy that you create where you basically formally say, we support wellness for employees and their family members, and we are going to offer a program. It's going to have these components. And the policy may go so far as to say we encourage people on work time to be involved in their own wellness. You can obviously have a smoking or a non-smoking policy or tobacco use policy. You can have a flex time for exercise, so you allow people to modify their start and stop times to expedite their pursuit of exercise, physical activity. You can have a health plan policy that emphasizes prevention, that has a preventive medical benefit in it. You can have a privacy policy that basically says to employees, all the information you provide in the wellness program is confidential. It's not released or provided to any other employees. This is oftentimes where you create the firewall between a vendor that's providing services like a health risk assessment or a well-being assessment and or a preventive screening activity and information on each individual that goes through it, which is not given to any employees inside the company. So all of that becomes part of a privacy policy. You can also have a vacation policy, which basically might say people need to take vacation. We feel it's part of their wellness. They need to have a time away, and we don't want people avoiding taking vacation. You can also have a wellness incentive policy. So you can say, we want to reward people who do wellness. So we're going to provide a lower premium contribution cost for those individuals that want to participate in the wellness program. So if you want to be active in wellness, you can pay less for your health insurance coverage for yourself and your family. You also can have travel reimbursement policies that say we want to encourage people not to overconsume alcohol or to eat in a very unhealthy way when they are on our travel status as salespeople or as people that are doing technical support or client visits or whatever you have that's a travel oriented opportunity. So these are some of the major policies we probably want to make sure are supportive of wellness in being able to show to employees that we feel wellness is important as an employer. The eighth strategy is to craft the physical environment by making changes in it that bring wellness closer to the individual's awareness. We may have message boards where we put wellness related messages, posters, and other kinds of things. We may have a fitness facility that we provide on site. We may have some quiet space that's intended to be used by people that need some time away from maybe a contact with the public, but they need some time to be quiet for a little bit, and it's just called quiet space. And it's a way that we can manage our stress more effectively when we've got very stressful kinds of activities that we're generally doing during the workday. In addition, there may be wellness posters that we put in various locations. There may be training space that might have some wellness-oriented messages attached to it. Maybe the food we serve when we train people also says something about our approach to wellness. We may have a computer kiosk, which allows people access to a e-health portal or a portal that can provide a lot of health information or access to the completion of a well-being assessment. We may have bike racks that allow people to bike to work rather than to drive to work. We may have a learning management system that enables them to get some content on maybe wellness or consumer health education or medical self-care or injury prevention or ergonomics or advanced directives. So lots of different things can go into our learning management system, regardless of whether it's an internally driven system or one that we're purchasing from an outside vendor. So again, these are the physical environment issues in the context of a work site. The ninth planning step is to check out key stakeholder needs around wellness. So we might be asking the CEO, what do you think about wellness? Or the CFO, or a chief operating officer, or a chief human resources officer, or the benefits and comp manager, or labor relations individuals, people that may be dealing with union relationships and labor and employee relationships. So the context here is you need to know these key stakeholders and what they expect from the wellness effort. So at some point in time, I want to be asking each of them, what do you want from the wellness program? What should we be attempting to accomplish? What do you think about the design, the one-page overview of our wellness program? The 10th planning step is to plan a simple evaluation. And that evaluation can track how many people are taking part in the program. It can ask people what do they think about the program, how satisfied are they with it. We can also look at well-being assessment or health risk assessment changes over time if we use the same cohort of people, the same group of people, and then see how they're changing and their health is changing. We can provide some measurement around biometric changes. So if we have that cohort from last year that also had the biometrics and we compare them with their results this year, we can then talk about average score changes. And we can also ask the question, how is our sick leave looking? Has the wellness program improved how people are taking sick leave? We also would probably want to know what work loss is taking place as people stay at work when they have an underlying health problem. So when they have allergies, they oftentimes come to work. Are they able to have those allergies without having a significant amount of their work productivity impaired? So those are a presenteeism related kind of issue. Now let's summarize some of the key points from this particular module. First of all, as we think about a quick start wellness effort, you want to keep it simple. You can do a lot without knowing all the details of wellness. There's a lot to know. It's a complicated field, but we can start fairly simple, fairly quickly. Wellness programs for small and mid-sized organizations can be relatively simple. You can do wellness in a simple way at first, but its long-term effectiveness will be questionable. So the problem is we can do wellness in this simple kind of way, but if you don't keep up with the things that are affecting the program and you're not aware of other things you can do to heighten the program's effect or enhance the program's effect, then its effectiveness will generally drop off over time. When pressed, you can start with MESS: move, eat, sleep, and stress. So that's a way for you to approach the core of wellness in a simple way. Lots of different ways to do wellness. The planning approach for small and medium-sized organizations is not as complex as for large organizations. So we can, in fact, use a more simple process. The 10 planning steps that we offer here can help jumpstart a wellness program effort. And each step in the planning process requires making choices among options. So part of what we're doing to get a quick start is we're not looking at all the options. We're just choosing a few options and we're implementing those few options. You also can take one step at a time and make several small incremental changes. So that's always possible, and it's always possible to break down your changes into smaller bite-sized pieces. And finally, it's really important for you to do formal evaluation of your program. So you do want to do some activities where you're reporting back to management what has happened in terms of your wellness program and what it's accomplished. Depending on the strategy that you have adopted, that will determine a lot of what the metrics are that you can actually feed back to management about the wellness program's effectiveness and operation. So in summary, these are some of the key points from this particular module. Now let's look at a few key questions. First of all, what should be done first when you are doing a wellness program? I think the first step that I would suggest is you want to clarify the mandate you have for a wellness program. You want to make sure you understand what management wants and needs. The second thing I do is prepare that one-page outline. That one-page outline is what you're going to use to actually crystallize the program and the design process. And the third thing is to get approval of that one-pager to move ahead. So those are the things that I think you should do first. Second question is, how can you keep your program simple? You can use a quarterly calendar with a listing of the various events and use it to both plan, conduct, and market your program. That's the best way that I know of to keep it simple and straightforward. Third question is, what is reasonable to expect from the program, given how we are doing it? I think you can expect fairly high interest and participation initially because of the novelty of a new wellness program. You also need to expect that participation will drop off unless you are using some powerful incentives or you've done some things to actually create more momentum with your program. But at least initially, I think you can expect a fairly successful program in the short term. The real challenge comes in the long term. And that's where the other kinds of things and details of the other modules, CE modules that are available on our website, and the certification level 1, 2, 3, and 4, that's where they come in, is being able to figure out what are the other things I need to do in order to keep this program alive and vibrant and effective. Now that you completed this particular continuing education module, go ahead and take the quiz.